Well, good morning, everyone, and welcome to another live this morning. Hope you're having a wonderful start to your week and day, and we're happy to have you come on. If you can, say hello. Let's see if I can see some names. Sometime last week, I don't know what happened one day. I didn't see a name. I see an emoji. There's Andrea. Good. Hi, Andrea. Hi, Alana. And Janice from Brampton and Nativity, good morning to you. And Lucille, nice having you on. There's Brahim, Portland, Oregon. Hi, Brahim. How are you, my friend? Rosalinda, how are you? From the Niagara Falls, cold. I mean, it is freezing here. Lisa, how are you? Sylvette, good morning to you. Mary, and saying hi to Dave and Helga. Karen, Peterborough. Fran, hiya, Fran. Elaine, St. John's, Newfoundland. Georgie, Halifax, Nova Scotia. Helga, and Dave and Helga. Patricia from Pulaski, Tennessee. Yolande is on with us this morning. Bonjour. Danny Lay, how are you? And Lily and Sylvette, how is you? Laurie, Cambridge, Ontario. There's Nick. How are you, Nick? Patricia and Etta and Sharon from Kansas. Lynn from Aurora. Good morning. Bonnie from Little Britain. Nice to have you on. Janice, how is you? Rosa, Moriat. And Brahim was saying it's almost 80. Well, Brahim, it's cold in Northern Ontario. Let me tell you that. Nellie, Dennis in Norwich, Judy, Debbie, and Cecilia. But the sun's out, so we're enjoying that. Madeleine, how are you? From Kippawa, Quebec, bonjour. Wanda, Ridgeway, Ontario, and Frida's on with us, and Linda's on with us from New Brunswick. Heather's on with us from Miramichi, and Vince, and Lise, bonjour. Marlene, Newfoundland. Cheryl in West Virginia. Oh, I could sing this morning. Brendan, Sedalia, Beverly. Thanks for coming on, guys. Marcin in St. John's, New Brunswick. Love you. Kathy. St. John, not St. John's. Jeanette. Milika, Claudette. Couple of more, guys. Another Janine, but from BC, bright and early. Thanks for coming on. Thanks for joining us in the morning. Arlene. Sylvia from Mississippi. We love Mississippi. Denise, Sandra, Lily, and Dave from Cardiff. Cheryl, how are you, Cheryl, from Lighthouse Cove? Irene from New Brunswick. Margaret. And Teresa from Mississauga. Karen, how are you? Andrea, they got snow yesterday in Niagara Falls. See? Cold. Paula Joe. Brandon in Indiana. And Dave in the clouds. Yeah, and you know what? I didn't see did I see the mayor's name this morning? Or Kevin from Oshawa? I didn't see it. Did you guys? Hi, Jill and Bonnie. Okay. Here's Joanne asking a question. Okay, so we're back to Q&A because Friday, of course, I didn't get through all the questions. But guys, if I had to take every day and answer questions, I would do it. Okay? Where on earth, Joanne, okay, her husband, he's on the reset. He's 31 days. His number's in the 120s. Well, in Canada, that would be about 6.7 or 6.8. First of all, Joanne, I got a lot of questions and you can't answer them because you're not on with me live. But if I could ask you several things, one, when did you get that reading? First thing in the morning? Your sugars are always going to be higher. Okay? Now that 6.7, depending, is he a diabetic? Was he ever diagnosed with diabetes? Where does all the sugar come from? Well, again, I can't compare it to anything. I can't compare it to his old numbers. And yeah, that's not anywhere near where I want to get his sugars. But one thing for sure, and I don't even know your husband. Let me say something that I know about him. If his sugars, after 31 days of the reset, are still elevated, him and carbs don't get along. Going to take him a little longer, okay? Again, I can't compare it because never taken, I don't know his history. But don't give up. He's on the right food. That I guarantee you, because at the end of the day, what do you want to fix? Your blood sugar, guys, is the last thing. Not your first thing. It's your last thing. What I'm more interested in is your insulin. And you do the reset. One of the major reasons is because you have metabolic syndrome. Did your husband have metabolic syndrome before he started? What is metabolic syndrome? Well, first of all, 93% of the population have it. And it's trouble with energy. It's trouble with insulin because your cells at the cellular level are resistant to insulin. It is the first thing that happens in diabetes. Not the last thing, the first thing. And what were his triglycerides? What was his HDL? What was his blood pressure? What was his original blood sugar? What was his uric acid? What is his vitamin D level? All of those things have a big, did he have belly fat? Because if he had metabolic syndrome, the reset is made to fix that. And 30 days for the vast majority of now at least 100,000 people have done the reset. Okay? Like this has been around for a while. And vast majority, they can fix insulin resistance within 30 days. Now, he's not there yet. Don't get discouraged. Where on earth does the sugar come from? Well, his body still, at the cellular level, is not at the place it needs to be at. And don't get discouraged by that. Again, if I was in my practice days and a patient came in, I put him on the reset, I do all the testing, I check his A1C and all this and that. And by the way, what is, you gave me a blood sugar number. Do you know what his A1C number was? Because that's really important for metabolic reset. So, again, Joanne, if you can answer those questions for me, send them to me in an email at info@martinclinic.com. I will get it and I will give you a better guidance specifically to your husband. And if he's listening, tell him not to give up. A lot of things, good things have happened already. I can guarantee that. A lot of good things have happened already, including in his liver. And inflammation markers, I mean, insulin, it may not be where it needs to be yet, but a lot of good things have happened, okay, in his body. He's doing the right thing. Grace is asking, dexamethasone mouth rinse, what do I think of it? Well, I know why they might give it, lichen planus, autoimmune. rinse your mouth to take the, look, whenever you're using either prednisone or cortisone, not cortisol, cortisone. And whenever you use these, like either in a rinse or you take a medication, why they are effective is they're a powerful anti-inflammatory. Okay? They're not a NSAID, like non-steroidal anti-inflammatories. They're the steroidal inflammatories. So when you get Advil, that's a non-steroidal anti-inflammatory. See the word? Steroid. So when you rinse, the doctor gave you a steroid. Okay? Now, one thing for sure, that is going to wipe out the friendly bacteria in the mouth. Okay? 100% for sure. And when you do a rinse, I mean, your body's absorbing some of that steroid. And look, it's meant to be very temporary. You know, like I know people, like if they have an autoimmune, like rheumatoid arthritis, they're on steroids. And steroids are a wonderful discovery, okay? In medicine, I mean it. Like prednisone, for example, is a wonderful anti-inflammatory on steroids. Because it is a steroid. But, and this is a big but, there's enormous amount of side effects to it. Okay? Because steroids suppress your immune system. They suppress it. That makes you much more susceptible to a lot of infection, bacteria, and viral, because your immune system's suppressed. And it's very hard on your adrenal glands. Adrenal on top of kidneys. So look, I mean, if I'm not quite sure why you're asking me, because someone probably close to you, Grace, is taking it, or you're taking it. But just understand, please, if you're doing a rinse like that, double up your probiotics. Double them up. You need to renew, replenish, and replace the friendly bacteria. Pamela is asking if you can take quercetin if you have hypothyroidism. I can't see one reason why not. Like I don't know the connection. Maybe if someone on the scroll, if they know something I don't know. Okay? I've used quercetin for many, many, many years. I love quercetin. It is a natural antihistamine. It is natural anti-inflammatory, but it's powerful for the lungs, and I like it even to lower uric acid levels. I like quercetin. I've been a big fan of quercetin for a long time. I would venture to say that thousands of people take quercetin, even with hypothyroidism. I'm trying to, in my head, think of why you wouldn't take quercetin. Okay? So if someone knows that, okay? I'll learn something every day. I mean, maybe there's a study out there that says you shouldn't do that. I'd like to read it because I haven't read it. Okay, that was Pamela. And Pamela, once again, thanks for the question. Cecile is asking a good question. I got asked this a lot. Can my dog take probiotics? Why not? You have no idea, okay? How many of my patients in the days of my practice were asking me that question. Can my dog take probiotics? Sure. Okay. Now a dog's microbiome is different than ours, right? Like a dog can eat, lick something off the floor, and we shouldn't. But what I found over the years, and listen, this is straight anecdotal. I don't know. I can't remember any study that I've seen. I'm sure there are a few. I wonder well, listen, I remember talking to a vet. And the vet, they gave probiotics to the farmers, or the farmers made up probiotics for their animals, the cows, and that gave them probiotics. Put it right in their feed. Yeah, they're good for you. Those are just friendly bacteria. And a lot of people, and this is, like I said, it's not necessarily based on, a science study. It's just a lot of my former patients and people that would give me feedback. They said, oh, my dog's so much better on probiotics. Their coat is better. Their digestion is better. And I mean, people know their dogs, and that's what they said. Okay? By the way, my brother, my older brother, is a professional dog trainer, Black Labs. He's had many champions over the years. And I bet you dollars to donuts he gives those dogs probiotics. Okay. Thanks, Cecile. Marcy, brown spots on your hand. Let me see if I can find a few on my hand here. Hold on. There's one. I got a brown spot there. Okay. I got a brown spot right here. Okay. What causes it? Aging. Mostly. Okay. Maybe a little bit of sun. Am I worried about it? Nope. I work on guys anti-aging this way, okay? I start inside out. So I'm big on probiotics inside. They affect your skin big time. I am big on the Navitol. Navitol is so good for the skin because it's such a powerful antioxidant, okay? But if you think there's magic, there's no magic. There's science, and antioxidants, for example, are very good. Just drinking water and coffee is good for your skin. Okay? But I don't look like I used to. I always show my grandchildren my graduation picture. I don't look like that anymore. I don't? No, because that was over 50 years ago. Okay? Okay. Thank you very much. And that was Marcy. Here's Gerald asking, what causes skin cancer? Well, again, I go inside out, okay? Because if you listen to medicine, if you listen to a dermatologist, it'll be 100% agreement just about. It's the sun, okay? Like cholesterol, there's two schools. The sun is the boogeyman, or the sun is the best thing that you can get. I'm in the other camp. I'm in the sun is the best thing. And listen, I never tell a person to burn in the sun. But the advantages of sun for your skin and for everything else is incredible. I wrote a book. Let me get a copy. Right in front of me. Sun, Steak, and Steel. The advantages of the sun in your eyeballs, incredible. On your skin, incredible. The biggest thing that I've seen, and I say this a lot, okay, because I'm a why guy. I'm a why guy. So when I see increases in skin cancer, I'm a why guy. Since the, what could I say? Since the invention, if you want to use the word, of skin, sun blockers and sunscreens, I think, and there is some research to show this, and I think I can prove it, that the vast majority of skin cancers are caused by sunscreens and a bad diet. Combination, terrible. Sugar, those seed oils, the wrong oil. We're eating it, consuming it. It was meant for your car. And this makes you more susceptible to skin cancer. There is more skin cancer today ever since we've been using, and by the way, let me make a point. The FDA, not me, the FDA, have taken over, I don't know if it's 100 or 200 sunscreens and taken them off the market. Because they said, not me, they said they were carcinogenic. Hello? When you can't even pronounce the names that are in a sunscreen or a sunblock, and you put it on your skin and then you add heat. My old chemistry class days would say when you add heat to chemicals on a Bunsen burner, you can get disaster. And I'll tell you, that's one of the biggest reasons, in my opinion, because that's what's changed. And by the way, let me give you another one on skin cancer. The most aggressive skin cancer is not basal cell, okay? It's not basal cell or squamous cell. It's melanoma. And we have more melanoma than ever. Why? We're not in the sun as much. People don't go in the sun as much. People use sunscreen. People are so low in vitamin D because they don't get in the sun. And sometimes if you live in Northern Ontario, you ain't seen the sun for 6 months. But the melanoma, this is a fact. Melanoma, the most aggressive cancer, skin cancer, happens to people, almost 90% of people that get melanoma, they work indoors. They do not get very much sun, if any. That's just a fact, guys. So you see, there's two schools. I'm in the opposite one of the mainstream, the sun, be careful, don't get any or get very little. And when you get in the sun, lather up. Lather up. Because the sun is the boogeyman, and I know a lot of doctors, I know a lot of people that's what they believe. I am the opposite of that. I don't want you to burn though. I'm not into burning in the sun. Cover up. I don't like sunscreens unless you have a natural one. Okay? That's me. So that's a little bit of a review. And I thank you for the question. And that was Gerald. And Gerald, merci for the question. Sedalia, what is the cause of a perforated bowel? Well, it could be several things. You could be in a car accident and your seatbelt could cause a perforated bowel in a serious car accident. And perforated bowel is very dangerous because you get sepsis almost invariably. All that garbage what was meant to go in the toilet comes into the bloodstream, and that can be deadly, perforated bowel. I've seen it with diverticulitis, where little pouches in the transverse colon, and that gets infected, and you get a diverticulitis, and that feces gets into the bloodstream and can be very serious. Okay? So anything with that in a perforated bowel, ulcerative colitis, Crohn's, I mean, anything like that can do it. Thanks for the question. Sedalia. Carm. He's 69. Carm, you're still a pup. I'm having symptoms of an old man's bladder. Join the club. But it ain't your bladder. It's probably your prostate if you're a man. But let me see. Having to go urinate frequently. Okay? Yeah. Can't drain it completely. That's your prostate, I think, much more than your bladder. Now, if you were a woman, your anatomy is different. Okay? I'm still, okay? Look at my face. I'm still a man, and a woman. Okay? I'm sorry. I'm just an old-fashioned guy. But your anatomy is different. And ladies, you got trouble with frequent urination and maybe a little dripping or whatever. Your bladder is descending. You don't have enough progesterone. Your bladder is a smooth muscle, and that's progesterone. Men, it can be your bladder. It's possible. But usually in a man, it's not the bladder, it's the prostate. Okay? A good friend of mine, he said something to me one time. He said, go to the show in the afternoon. Okay? I've done that with my wife. Okay? A matinee, because we want to go to bed early. Okay? We go to the movies in a matinee, and he said to me, observe this. Men will get up and in the middle of the show and have to go to the bathroom. And he says, because it's all seniors there at the matinee. The men are going, he said, just say prostate. French for prostate. It's the prostate. And okay, so now Carm is asking me, what should I do? Because the doctor wants to put him on a med. Well, here's what I found with the medications for prostate, okay? I didn't find them over the years to be all that effective, to be honest with you, okay? I really don't. And when it comes to prostate, guys, okay, listen, not Linda. Well, Linda, you listen because you can tell your husband. Larry, listen, okay? It has to do with a couple of things. Your estrogen is too high. Your estrogen, woman's hormone, makes your prostate grow. There's way too much estrogen in the world, xenoestrogens, and men get affected. Of course women get affected by that. But men too. The other one, Carm, is another growth hormone. And when you mix them together, not good. Insulin. Insulin makes your prostate grow. So does estrogen. And your testosterone is going down. It's normal in a way, but maybe it's going down too fast. And I'm big on, and you know what's good for your testosterone is vitamin D and get strong. Okay? Vitamin D, the sun. We just talked about the sun. That's very good for you. I like the combination, okay, of dim and start using flax seeds because they dim out because they have high lignans. They lower your estrogen in a man, in a woman too. Okay? And lower your insulin. That's food. And what was I going to say? Flax seeds. I love Navital. Why? Because it opens up the little capillaries to your prostate in men, even to the bladder in women. Okay? A lot of men love zinc. That's why I love zinc too. Eat your steak. You get a lot of zinc. Okay. That was Carm. Janine, 65 years old, 5'1". Okay. Had breast cancer many years ago, struggling with, it's not you, Janine, it's your neighbor. Sorry. I just read that. She has fibromyalgia. No fun under the sun. I wrote a book about it. I wrote several books on fibromyalgia. Come to think of it. Okay. Energy Robbers and the Fatigue Cure talked all about fibro, because fibro is a symptom. It's a two-headed coin. You have chronic fatigue and you have fibro. They're the same baby. Fibro is inflammation, pain. And there's 4 major symptoms of fibro. Fibro is the pain, okay? Comes out of nowhere, no fun under the sun. You have severe, usually fatigue with it, brain fog, cognitive, okay? And sleep disorder. Because I did my thesis on it, guys. A long time ago. Okay? And so look, when you have this condition, you have adrenals that are exhausted. You got to fix you're in what I call a hormonal storm, category 5. And you got to work it all, okay? I used to, with fibro, I did this with tens of thousands of patients. Let me see if I have it in front of me, because I might as well do it. But I don't. Let's see if I drew it. I got a new notepad here, so I didn't do it on this one. I always do this because I used to do it in my office all the time. Let me just see if I can find it on this notepad. Nope. Anyway, I would draw a pyramid. I'm going to show you, okay? I put circles. Why don't I do it like this? All right, then you can see it. Give me a moment, okay? This is me, okay? And I did this 10,000 times at least in my office. Women with hormones, women with fibromyalgia and chronic fatigue syndrome. I would draw them a pyramid. And I said, this is you, okay? And I would turn it around, and there you see it. I should have used maybe a darker color than that, okay? See the pyramid? Okay? And I would do this. I would go at the top of the pyramid, okay? Right here, at the top is what? Your thyroid. It's affected. But it's not just your thyroid. This is your pancreas. See the middle circle? That's your pancreas. Insulin. Fix. I'll show you how to do it. On the 2 sides, I would have your adrenal glands. They're the major problem in chronic fatigue and fibromyalgia. At the bottom, I had the ovaries. Very, very important in women. And of course, in the middle, I'd often draw a circle for a man and show him his prostate. Okay? When you fix these, and because of fibro, usually all of those circles are affected. The thyroid, the pancreas, the adrenals, the ovaries, estrogen and progesterone. You better balance all of it out. You have to fix. So you start with the diet. And it sounds like, okay, let me just get back to the question. It sounds like Janine, she has been, she laid off the bread, or she reduced it. Reduced, and she started on the right track, because you have to start with food. You have to. Because if you don't fix your insulin, and I guarantee you, without even knowing your neighbor, she has insulin resistance. I guarantee it. I guarantee it. And I bet you, this is just me, I bet you, besides what I showed you in the pyramid, that she is deficient. Now, again, I don't know her, but I bet you, just because I saw this tens of thousands of times over the years, she is deficient in vitamin B12. She is deficient in vitamin D. She's probably deficient in magnesium. Okay? She is insulin resistant. Her cortisol, her stress hormone, is too high. She has estrogen dominance, and her thyroid has slowed to a coma. I guarantee it. Okay? Why am I so confident? Because I've been around the sun many times. And I was in practice for a lot of years. And I actually specialized in that. People came, guys, I'm not kidding you, to my clinic all over the world to see me about this, because I wrote about it. And I was on TV, and I was on radio, and I talked about it. And women crying. Somebody finally listens to me, because all my blood work is within normal limits. That's scary when a doctor tells you everything's normal and you feel like crap. That's scary. I was a patient's doctor, meaning that my patients were everything to me. And I believed them when they told me they weren't feeling good. But then I didn't have to guess. I test. And that's why. Tell your neighbor to send an email into info@Martin Clinic. Give me some history and I can help them. Okay. Tell them what to do. Okay. Beverly, I know we're a little bit over time here, but I have a question regarding berberine for high LDL. Does it work for LDL? I'm trying to think. Berberine, I know it helps with your blood sugar and insulin. It's not my first choice, but I like it. For LDL, well, anyways, okay? And again, I know, Beverly, because you want to get your doctor off your back. You got to get your LDL down. I'm sorry, but your doctor's looking for love in all the wrong places. And good luck trying to get your doctor off your back. I just don't. Look, again, we're going to go into what I just did with skin cancer. There's two schools. Jesus said there's two roads. There's a narrow road. There's few that'll be on it, and it leads to life. And he said there's a broad road, and it's very popular. And everybody, like, people flock to the broad road, but at the end, there's destruction. This is me with cholesterol. There's a narrow road. There's few of us that say, nah, cholesterol's not the boogeyman. The sun is not the boogeyman. Okay? We're in a little narrow group, small, few people. But I've been consistent. And I know there's a large group out there, and they say they got the science. But this is a fact, okay, Beverly? This is a fact that if you have high LDL, you're going to live longer. A fact. What I want you to focus in on, and I know I'm not answering your question the way you want it because you want your doctor off your back. There's you know, you want to get your LDL down. I can't tell you what to do because I don't believe that. You want to try berberine to get your LDL down? Look, maybe that it works. I don't know. To me, I don't see the connection. But you have to understand, and I know I'm in a small camp. And I know I'm up against big pharma. I know that. And big food. I know that. But I believe I'm right. And guys, I've been saying this for so long. And I have to say it every week and sometimes every day of the week. And that's all right. I mean it. Because you're going to get pressure from your doctor who is trained on the broad road. They still look at cholesterol, especially LDL, as a boogeyman. I don't. I look at triglycerides and I look at HDL. And I want your LDL to be high. I don't want to lower it. I can't answer your question, Bev. I just can't answer it properly to get your doctor off your back. But I love you for asking. Beverly, I do. Okay? It's just I'm on a different planet when it comes to cholesterol than 99% of the population. They made it a boogeyman. They made LDL because they found a medication to lower it. And if you really want to make your doctor happy, take a statin drug. Because that'll lower your LDL 100%. But why do you want to do that? Other than pleasing your doctor. Look, it's costly to go against your doctor. It's costly. But if you're well equipped and you just look, you know, people, they get low cholesterol and they die. And on the way out, are they saying, oh, thanks, doc, you lowered my cholesterol? I don't know. It didn't even make a dent in heart disease. Not even a dent. And I'm a why guy. Why aren't these things working? Because they're looking for love in all the wrong places. Okay. I think I have a few more. We'll answer them tomorrow, and I'll probably have a couple of studies. Okay? Oh, Karina was asking. Okay? Regarding high LDL, might as well, if one's blood is blocking arteries enough to have a heart attack and need a stent, how does one treat that other than using blood thinners and statins, especially after stents have been put in place? Well, you're going to definitely be put, and Dennis is there too, unless that's your last name. Okay? You're going to be on a statin drug if you've had a heart attack. Do I believe in that? No. But if you've had a heart attack, they're going to put you on that 100%. And you're probably going to have no choice. But that wouldn't be my choice, but anywho. Okay, guys. Love you dearly and sincerely. And those I didn't answer your question, I'll get to them tomorrow, I promise, as we continue on. Great week. Send your questions in. Love you dearly. Talk to you soon.